I'm Dr. Jeffrey Donaldson, board-certified plastic surgeon.
I'm Dr. Michelle Sieffert, also a board-certified plastic surgeon.
Today we're here to discuss the most searched questions on the internet about plastic surgery. Are you ready?
Let's do it.
How long do breast implants last, and do they need to be replaced?
So the textbook answer is breast implants need to be replaced every 10 years. The manufacturers of breast implants studied their implants for a length of 10 years. So by law, they cannot recommend keeping an implant in longer than 10 years. I think practically, they don't have to be changed out every 10 years. I don't see any pressing reason, if everything is going well and you're happy, to go in and just swap out implants. Do plastic surgeons still use leeches?
Indeed, yeah. So leeches are still used. In fact, in all of our plastic surgical journals, you'll see advertisements for leeches in the back. But patients don't need to be worried that we will use leeches because
Correct.
we're not doing the types of procedures that would require a leech.
Yeah. In residency, we had a couple of escape leeches that would end up scooting out the door and onto the unit. So they leave a little trail behind them.
And actually some surgeons will use sterile maggots, but you don't have to worry about sterile maggots in our practice.
Yeah, we don't use those either.
Will a neck lift get rid of deep necklines or bands?
A deep neck lift can get rid of deep necklines and bands. Some of the horizontal deep neck creases are more difficult to treat with a deep neck lift and may require the use of filler, but those are actually quite difficult to completely get rid of. Can you get breast implants without having any scars?
No.
There you have it, ladies and gentlemen.
So it's impossible to place a breast implant without creating a scar, but sometimes we'll call it scarless breast augmentation if you go through the armpit, if you go through the belly button, those other areas which keep the scars off the breast. But no, there's no way to enter the skin without creating a scar.
And the reality is these are such small scars and they are generally all very well hidden. You have to trust that your surgeon is trained well in the technique that they use and where they put their scars.
How do I eat after a neck lift?
After a neck lift, you would eat like you normally would.
Oh, good.
You just don't want to sleep with your head down because that can create creases in the neck. I recommend sleeping with the neck either neutral or a little bit extended while the skin is healing so that there aren't any creases accidentally formed as a result.
But the eating is traditional: fork, knife, spoon.
Yeah, you don't have to eat with your hands or like slurp through a straw or anything like that.
Excellent. If you have more questions, just reach out to our office.
We look forward to hearing from you.
If you have questions,
We have answers.